My name is Kim Brecky, and I'm the Edgewood moderator for today's panel discussion. This is our third session in our six-pack series. So for those of you who have joined us every time, welcome back. For those that are brand new, thanks for joining us. A couple housekeeping items before we get started. All lines are muted and your cameras are off. I know you can see us, we can't see you or hear you. A lot of that's just so we don't have background noise and other interference. But if you have any questions and you are on Zoom, please at the bottom you have a Q&A spot that you can type in your questions to. If you are on Facebook Live, please type your questions into Facebook Live, and then we will also do our best to answer those here live and as real time as possible. We've done pretty well the last couple sessions getting through questions. If there's anything that we don't talk about, we run out of time today, we will do our best to answer after the fact. Also, today's session is recorded, so if you have any family or friends, loved ones that are not listening, you hear something that you think is relevant, that you think they would find helpful, at the end of today's session, we are going to email out a link, and that will include today's recording, so you can always watch it at a later time if you leave early or have somebody that you want to share this with. So again, to introduce myself, I'm Kim Brecky. I'm Regional Sales and PR Director for Edgewood. I'm in Region 1, South Dakota, and I live in sunny Pierre. That's actually kind of cloudy right now, but thankfully we don't have the snow right now. And I'll pass it around for everybody else to introduce themselves.
Hi, I'm Brendan Weidler. I am the Regional Vice President for Caring Edge for Home Health, Hospice, and Outpatient Therapy Services in North Dakota, Minnesota. And I reside in Bismarck, North Dakota.
Hello, my name is Jacqueline Poole. I'm the Director of Therapy and an occupational therapist in Casper, Wyoming, over 2 clinics that we have here. And yeah, I've always lived in Casper, Wyoming.
I'm Missy Johnson. I'm Vice President of Home Care Services for Edgewood, and I reside in Grand Forks.
Hi, I'm Brenda Munson. I am the project coordinator and coordinator volunteers for the North Dakota Senior Medicare Patrol Project. I've worked with S&P since about 2009. So yeah, live in Minot. I'm actually my office is housed at Minot State University, and I am happy to be on this panel. Thank you.
Thank you all. Brenda is a familiar face. If you were on the first session, she was already a panelist with us on the first one. We're happy to have her back today and everybody else joining us. Today's session is going to talk about safety and security for seniors. What happens when home might not be the safest place for them anymore? During COVID, we know especially that maybe we're checking on our loved ones regularly still. Maybe instead of popping in and saying hi to mom, we're not going into the house anymore. We're just calling and waving through the window. Knowing that the home might not be the safest place anymore, how do we monitor that? What does that look like? How do we keep an eye on isolation, physical safety, as far as also worrying about their emotional well-being? So today we have different panels that are each going to talk about their area of expertise. And I'm going to have Brendan start with just sharing his story about a loved one of his, and we're just going to talk a little bit about his journey with Edgewood, and that might help with if you have a loved one that's living in senior living, or if your loved one's still at home, maybe some things to watch for and keep an eye on to keep your loved one healthy, safe, and secure.
Thanks, Kim. You can wave or throw something at the camera if I get too windy here. This story of Grandpa Herald, which is a favorite for me and my family, because everyone likes a success story, and this is a great one, has really turned into more of a saga at this point, with him navigating through basically every aspect of Edgewood healthcare that there is possible. But it all started back in 2018. I had gotten a call from my dad about 3 days apart. He called me the first time and said that Grandpa had fallen and had a tough time getting back up into his bed. It was in the middle of the night. He had to go to the bathroom or something. And then 3 days later, he called me again and said that he had fallen again, and he was, had some concerns, and wanted to let me know that he was getting a lift chair. That was his solution. He needed a lift chair for the living room. Anyways, a little history on Grandpa Herald. At this time, he was about 90. This is a guy who retired from farming at the age of 85 for one reason only, and that was because my grandma, Lois, had Alzheimer's and was attempting to drive into town on a regular basis. And so he retired from farming and stayed home with her to make sure that he kept her out of the vehicle more than anything. But so I was pretty nervous about offering services to him. He was a little bit outside of our service area, but I spoke with our marketer in Minot and got some information on short-term stay. And then I talked to all of his kids. He's got four children, Grandpa Herald does, my dad, and then 2 other boys and a daughter, and asked for their blessing. And they all kind of gave me yeah, you sure can talk to him, but good luck. So I went out to Grandpa Herald's house sometime in October in 2018. It was a Friday or Thursday maybe when I went out there. And I introduced the idea of potentially moving into short-term stay. I had pricing, I had it all. I had it all ready just in case. And I gave him all this information, and he said, well, I've had therapy before. Why would I move into Edgewood to get therapy? And at that point, I was as nervous as I've ever been talking to my grandpa, trying to ask him to come live in a senior housing development. And I told him, well, I didn't hire the therapist that saw you last time. And my background's nursing. I pretend like I know anything about rehabilitation, but I had to show him some confidence, because what Grandpa was lacking at that time was confidence himself and his mobility. And when I was out there, I could see pretty plainly that he was not doing a whole lot in his house because he was concerned with falling again. And long story short, with going out and seeing him, I left with absolutely no idea if I had any buy-in from Grandpa at all. And the next day, my dad calls me and says, hey, Grandpa called me this morning. He's wondering if he can move in today. And I was blown away. And I said, well, let me talk to the marketing gals and the leadership team here, and this is in Minot, North Dakota. And they said, well, we can't have everything put together by today for a short-term stay room, but we can by tomorrow, or by Monday, sorry. Everything can be ready by Monday. So he moved in on Monday into a fully furnished short-term stay apartment, and we got him on home health. He met the requirements for the Medicare service home health, which is reimbursed under Medicare Part A. So it's, under traditional Medicare covered at 100%. We're able to provide him with therapy services, as well as some nursing services. He didn't need a lot from Edgewood at that time in regards to, dressing or medications or any of that stuff. And so that went really well. But at that time when he moved in, getting him from the front door to his apartment was tough, just because he had depleted his mobility so bad by not doing anything because he was afraid of falling, that he really needed some serious work. And so we had him on home health for a couple certification periods, got his mobility back up to the point where he could walk across the entire building. And in Minot, the building's quite large. And my office was at that time in Minot, and just about as far from his room as you could walk. And so I suppose it was in the spring, he was walking down and going to the gym every day. He would go down there and ride the stationary bike or whatever I think he might have used a New Step, if you're familiar with that machine. And he would go down there every day. And then he participated in outpatient therapy for a period of time because he had some goals that he wanted to meet in his mobility. and he was able to do that. And he wanted to, be able to go back out to the farm potentially at some point in time. And along the way, he realized living on the farm and socializing with, the 4 other guys and his wife only, maybe he was missing out on something. And so he really started to like living at Edgewood in Minot. And I don't remember what time it was, but he came down to my office one day in June, I think. And he said, Brendan, outpatient therapy said that they're going to discharge me. Are they going to kick me out of here? And I said, Grandpa, you can stay here for as long as you absolutely want to. They're not going to kick you out because you met your goals. And so at that point, this was June, mind you, he said, well, that's good because they're starting to spray already. And before you know it, they're going to be harvesting and then we're going to have snow again. And so I just soon stay here if it's all right with everybody. So he moved in as a permanent resident around that time, which was really good for him. Came down to my office and bugged me a lot, which I appreciated. And he had a really nice stay with Edgewood for a period of time there in an assisted living apartment. During COVID, he started having a little bit more cognitive difficulty, and it was recognized by staff and family that maybe he would benefit from the programming in the memory care. And so sometime this summer at some point, we were able to move him over to the memory care, and he has really done well over there, and that's where he resides today. So the saga continues, but that was the abbreviated version of my Grandpa Herald story, and what a success story it's been for him.
I think you bring up a really good point, Brendan, and not to also have a story, but I think the idea of moving in permanently can be very difficult for people. And so the idea of a short-term stay can be a really nice way to introduce the idea. My husband's grandparents, at one point in time, he had all three living grandparents living at Edgewood because they had all come kind of temporarily, but then decided it was okay to stay. So obviously that's an option. But then there are still people who are still at their home. They're still living at home. So maybe, Jackie, you can introduce to maybe like kind of the Grandpa Herald moving in, some of the things that if he was still living at home that Brendan and his family were doing, or that you can recommend to families on some of what you see when individuals are still in their home.
Definitely. I first off want to start off with, I love facts. I feel like having short facts to understanding what the rest of the world looks like really gives us a good view of, that we're not alone in those situations where we have people that are in our family that are sitting at home that may not be safe. So I got all of these facts from the CDC. And we say these to our residents that we have on caseload for falls all the time, just to bring that awareness. So according to their facts, 1 out of 5 falls that a person has can cause a serious injury, whether it's broken bones, a fractured hip, a head injury, and over 800,000 patients a year are hospitalized for falls. And it is because of those serious injuries like a hip fracture or a head injury. And the falls are the most common part of causing a traumatic brain injury. But backing up to one thing that Brendan said as well, he said that his grandpa wasn't moving as much. And one thing that we always like to say to patients as well is if you're sitting for a 24-hour time period and you're not moving, they say that you lose about 20% of the muscle that you have in that 24-hour time period. And then it takes you twice as long to get it back. So if someone's sitting in a hospital bed or in their chair or in their bed at home and they're not moving and they're like that for a week, it's going to take them 2 weeks just to get back to where they were. Even if they were a week before, it's going to be longer. So some things that I wanted to talk about as well is it's not always falls that cause that safety concern at home. And there are a lot of other things that can be a telltale sign for if someone is needing increased help at home. So some things to look for that not many people really consider is, if they have lower body weakness, if they have vitamin D deficiencies, if they have, of course, difficulty with walking or balance, which can lead to those falls. One that not a lot of people consider is if they're using multiple medications, such as a tranquilizer or a sedative or an antidepressant, or a combination of a lot of those medicines can cause dizziness, lethargy. So those are things to watch for as well if they have multiple medications. If they have chronic foot pain or if they have poor footwear, that can also, cause safety concerns at home. And environmental concerns can definitely be if they have uneven ground in their homes, if they have broken steps, or if they have throw rugs around that may not be secured to the floor, or clutter that they can easily trip over. So those are definitely things to look for safety problems at home. And things that you can do for taking those steps is, talk to your doctor, have them evaluate that risk with that loved one and see if there needs to be something more that you are doing, whether it is a home health care, looking at a respite stay in a senior community, or having, outpatient services come in and evaluate them. And the next step was doing strength and balancing exercises. So, of course, therapy, which I'm a big proponent of course, ties in nicely to that, where, if you bring them in to have an occupational therapy or a physical therapy eval, or both, because we both look at different things, we can evaluate, their balance risks, their fall risks, if they have lower body weakness, if they have impaired sensation in their feet to where maybe they're not feeling where they're stepping, if they have maybe some cognitive issues where speech therapy can come in and work with their cognition, if they have poor safety or spatial awareness. With occupational therapy, we're very good at home modification and looking at that home setup, are they, when they're getting up in the middle of the night, are they disoriented and going to the bathroom? Is that where they're going to have the most risk for fall? How can we make that safer? So therapy is definitely, your best friend when it comes to looking at those complex set of things, because we take such a multifactorial approach to evaluating someone and safety in their home. Occupational therapy and physical therapy, our associations nationwide press very heavily how we can prevent falls and fall prevention, just because of, the high statistics there are out there for elderly in their home that are falling. There's another statistic I was waiting to bring up, but and they haven't done this since 2015, but total medical costs for falls totaled more than $50 billion in the United States in 2015. And 75% of that was Medicare and Medicaid costs. So you can safely say that 75% of that was the elderly population. That's huge. And that's money, that's money out of your pocket, out of your loved one's pocket because of those falls. Whereas if you're doing an earlier intervention with doing a respite stay or doing therapy or home health care, that's way more cost effective to preventing any sort of thing like that happening. And yeah, I don't think you're wanting any more from me, are you, Kim?
I think that's just good for people to know what to kind of maybe watch for. And I think that helps people maybe know just some of those things to keep an eye on. We do have one question that came in that Dean was just saying that it looks like it's might be advantageous to move into a community retirement home while being capable of logical thinking without impairments. True. Jackie, I'll let you answer that question, or that first. And I think I would agree though with that it is a good idea.
I'm sorry, you broke up, so I didn't get that full question.
Sorry, the question was, it's beginning to look like it might be advantageous to move into a community retirement home while being capable of logical thinking without impairments. Is that true? I agree it is true. What are your thoughts on that?
Definitely. About 80% of the population that we have in our senior living facilities here, they are quite capable cognitively. It's just that physical component that they are having difficulty with. So, and it's also nice if they do have that cognitive awareness. In therapy, if we're working with them, we tend to always try and send home exercise programs home with them. So if they have the ability for carryover with that, and even if we discharge where their goals are met and they can continue to do those exercises, that's a prevention method, preventing them from having that decreased weakness, having that decreased mobility problem. So yes, I very much agree with that.
I think along those lines too, that I've had conversations with a lot of family members through the years that sometimes the research isn't done. I'm going to turn it to Missy to talk a little bit about when and how to have that conversation. But sometimes if those conversations and decisions aren't made ahead of time, they're made in kind of a knee-jerk reaction mode where people are reacting to a situation and it's something that's happened. Maybe a fall has happened, the hospital says, no, dad can't move home anymore, but then you haven't made a decision on what the next step would look like. So I think it is advantageous to have those conversations, move in while you can still enjoy it as well, because I think there's lots of things that you can enjoy and get to know in the communities. We're always talking about that with Edgewood and how wonderful it is, the different amenities that we have in our buildings, because it's not just a old folks home, as people like to say, that they're wonderful communities that offer so much for any of our residents that live with us at our communities. But Missy, turning over to you for a minute, that conversation is difficult to have. And I know Brendan said it, he didn't say it on this, but on our practice session when we were talking, I'm going to let you say it, Brendan. The conversation with your grandpa was what? You need to say it yourself because it's better than me saying it for you.
I liked it to asking my wife now, my fiance, or before that, my girlfriend, to marry me. And what I said was I was less nervous to ask her because I was pretty confident what her response was going to be than I was asking my grandpa to come live in Edgewood for a little while and do therapy under our services, just because I was so nervous that he was going to be upset with me for even asking him. But I didn't get a lot of response at that time, but I got a good response the next day, I guess.
Needed time to process. And I've had residents, seniors say, I'm proud of them when they have made the decision on their own, because often they'll say, well, I don't want my kids to fight about this. I want to be involved in my decision making, and I want to have a say in it, and not that make them decide for me. So if you are listening and you're thinking about what the steps are for your future, I'd encourage you to look into options and make that decision for yourself rather than just kick the can down the road and make your kids decide for you. There's nothing wrong with that either, but it's great when you can be involved in your decisions. If you're a kid though, an adult child that's listening to this, following along on Facebook, watching on Zoom, Missy, how do you recommend that the conversation get started, or why the conversation will get started?
The past 15 years, it runs the gamut of when people have this conversation. Unfortunately, most people wait until there's signs Jackie talked about. That's not really when you want to be making decisions on where you want to live and the services you need. Having that conversation when, like the person who asked the question of when you have the mental capacity to do it, how long can I stay in my home? What services could I use in my home? It's good to have that right even at retirement age. And most people are doing, planning and living wills and those types of things as early. I mean, I've had the conversation with my husband already. Of course, everybody would like to stay in their home as long as possible. People have other reasons for wanting to move into facilities. And that's what I love about Edgewood is we're here to care for people where they're at. You don't have to necessarily move to the facility to start these conversations. This should start in the home, because Brendan offers they offer services, our home care offers services, and just educating yourself on what's out there and when is it time to move? Like, how many of these signs should be present when it's time for me to go to assisted living? Or, some people we all know them that don't ever want to go to assisted living until you have to carry them out of their house. So, just knowing that, and anybody with a parent that's aging should have these conversations. And it shouldn't be Brendan's case where he's scared to talk to his grandpa. That conversation should have happened years ago. And it could just be casual and planting the seeds. Like, hey, where do you see yourself when you retire? Like when you can't, when you don't go to Arizona anymore, or when you don't drive anymore, where do you want to be? I mean, it could just be opening up that, the word we keep going back to, opening up that conversation. Just a casual conversation, because even the littlest bit of information to know what they want or get your point across to your family will save you endless worry, and not that you have to be in a position like Brendan, worse than asking your wife to marry you.
Missy, along those lines, Dean asked a follow-up question. Are there any tests on enrollment to determine baselines physically and mental and whatever else? So when you are meeting with people and they're in their own homes still, are there any baseline tests? I know at Edgewood, when we're doing an assessment, that we do have some that we use, but what about even before that?
When we go into a home, well, first of all, we're making sure it's safe, because a lot of times when we start, it's only 2 hours a week or an hour a day. We need to make sure that that person's safe those other 20 hours a week that we're not there, or whatever it may be. Checking out the bathroom, visiting with them, asking them questions like their birth year, and you kind of get a pretty good idea. You find out fast if somebody's beyond the level where we don't think they're safe in the home. And then that's when we try to pull in some of our other resources in Edgewood. Maybe it's a case, there's something going on that we need to bring home health in, where Brendan would step in. Then it's just kind of a comprehensive group that if they're in their home, a lot of times the home care or Brendan's home health is the first in front of them. You kind of get a good idea. And a lot of times you're helping counsel the family too on what you think would be best. So there are tests, and like our memory care can do them, but oftentimes if they're having you come into the home for the assessment, they're not quite ready for that yet. So it's just having somebody with experience that kind of knows how to identify some of that, help
Absolutely.
The family. That's where the family can turn to too, saying, I don't know how to bring up this conversation. So then I often am the one going in, because they'll answer me more than they will their family, maybe a little more truthful.
Okay. Thank you for answering that. Jackie or Brendan, are there any baseline tests that you guys recommend to anyone? I know, Jackie, you had mentioned one in our practice session, a little bit about the sit to stand transitions. I think that's a really worth mentioning, because that talks a little bit about some of that physical strength. And I think that one's worth mentioning maybe.
Definitely. So it's called a 30-second sit to stand chair test. And basically what we do is we have them sitting in a chair that has arms on both sides, a back, and isn't a seat that they sink into. It's a little more firm, and we test their ability to stand all the way and then sit with their back touching the backrest is counted as one stand, and how many times they can stand in 30 seconds. We like to see people above about 9 stands. Normally when they are lower than that, then we do consider them moderate risk for fall. Another one that we use that's a pretty short telling test is called the functional reach test. And we can do that in 2 ways. The modified functional reach is when they're sitting down, and then the functional reach, the full one, is when they're standing. And that one's a pretty telltale sign. They can't have anything, on their legs in the back, so they have to step away from a chair, and then they have to let go of any assistive device that they may be holding, and they'll put both hands out in front of them and reach as far forward as they can. We like to see normally people over 10 inches with that to say that they're safe from those falls. If they're below that 10 inches, we do consider them a low risk. If they're below 6 inches, we consider them a moderate to high risk. With the modified functional reach, that one's a little different. That one is for people that may be more wheelchair bound. We like to see them over 15 inches. Anything below that, we are a little scared about that as well, just because if they're wheelchair bound, they're mostly getting around being in their wheelchair, and that's their primary mode of mobility. So if they're having to reach in the wheelchair and they can't reach very far, they're kind of stuck, and that puts them at risk for falling out of their chair if they reach too far. So just a couple of tests that we do. We do quite a lot more. I mean, when we do a full evaluation for someone that has balance deficits and they've had previous falls, it takes us about an hour because we do multiple tests with people.
Thank you for walking through that, the physical side of it as well. There's a comment here from Melissa saying that her mother has Alzheimer's. She's fallen a lot. Sister and I agree she needs to be evaluated for inpatient care. My dad's dragging his feet, and that cost is a huge factor. I'm sure all of you have heard that as far as cost being a factor. Maybe let's bounce back over to you, Missy, and talk a little bit about PCS and home health. And maybe can you give us the difference of what that looks like? Because if cost is a factor, sometimes maybe there are some services in the home that would still be available to them that would help. So maybe if you could walk through what those are.
PCS is what we call non-medical home care. So it's anything that's getting more difficult, the tasks of daily living, like helping with bathing, shopping, cleaning, light housekeeping, just those meal prep things that maybe you're not able to do 100% on your own, where home health is more medical, where blood pressure checks, medicine checks, wound care. Brendan could speak to some more of that too. But the PCS is more the non-medical, the tasks of daily living that because you can't do them, it's going to cause you to move out of your home. Where if you had a little bit of a help, it might be able to extend that time in the home. And yeah, that's what it.
Missy, do you want to touch a little more on having a plan and what you think that looks like for families?
The plan looks like, are you opposed to moving out of your home? If you can't get out of your chair on your own anymore, do you hire the help to do it and assist you in the home? Or are you okay going to a facility or an assisted living? Just having it spaced out, like if I can't do this anymore, then, or if what, when, just outlining that, is it too soon? And knowing what's in your area, like, okay, I know I have this, I know I have Caring Edge, I know I have Home Care Companions, I know I have Edgewood Assisted Living, just knowing and having a plan that if and when it comes to that, mom and dad are okay with this, or I don't want my kids to have to make these decisions, so I'm doing it now. I just had a lady who totally planned her whole, she's been our client for 5 years and she just passed away in her home because she made that plan and her family followed it.
That's a really good point. We did have a comment that came from, and this is, I think, one that we've all heard. If you have a conversation and the answer is, I'm leaving this house toes first, or in my 90-year-old dad's case, leaving his business toes first, and he's dead serious. What do you do when, how do you approach that? And this is to all of you, but Missy, since you're chatting right now with us, what do you do when somebody refuses to leave their home when maybe family is aware it's not safe anymore? Do you guys have any suggestions on what that conversation should look like?
Yes, you have somebody like us come in, or, Brendan, we offer a lot of help with the families. I'll just use Helen for an example. She was our 90-year-old. She's been our client longer than 5 years, but off and on, like probably 10 years ago, she started with a surgery, just needed our help after. And then off and on, up until 3 months ago, she would just call us when she wanted to, light housekeeping, take her to a grocery store, appointments. Up until 2 months ago, she really started failing and had fluid that home health was coming in. And then it got to where she needed 24-hour care. And she had it all laid out where she had 24-hour care with us. And then she called hospice herself, had hospice coming in. When it got to that point, she knew what she needed to do. But I had started that conversation with her 10 years ago. She's from my hometown. But that's how it got in the door, is she knew who I was and what I did. And 10 years ago, then, we told her how we could help throughout this whole process. And she left her home toes first, put it bluntly. But she knew what she wanted, and we were able to help her succeed with that, with getting other aspects involved like hospice and home care. And she, before that, had palliative care. So that's
Brendan,
awesome.
Do you think, Brendan, you could walk through a little bit of home health services? I know you said with your grandpa it wasn't an option because of the location, but do you want to walk through what that looks like?
Sure. And this might be relevant to her 90-year-old father not wanting to leave home either. And really, with starting home health, hospice, and outpatient therapy services, the focus on promoting first and foremost active independence in whatever your living environment may be. We would love nothing more than to go to someone's home and provide those services. If their home happens to be assisted living, that's where we provide the service. If it happens to be in a condo or a duplex or an apartment or whatever, we're happy to provide the services so long as they're within our service area, wherever someone calls home. And home health is covered under Medicare Part A, as I had mentioned earlier. And so with your traditional Medicare, it would be covered at 100%. And you can receive skilled nursing services for a variety of reasons, as well as some therapy services through that platform. It is ordered by a physician, and you do have to meet certain criteria to qualify, such as the homebound status. And the simplest way for me to explain what a homebound status would be is really that it's just a taxing effort or dangerous for you to leave your home by yourself. And so there are a lot of reasons that you can still leave your home under home health and still meet the homebound criteria. Things like so long as the trips are infrequent and not regular. So you can still go to your hairdresser or to religious activities, graduations, things like this. Of course, under COVID times here, there's not a lot of people leaving their house for many reasons. But yeah, home health, when we're in somebody's home, we're not telling them where they need to live by any means, but just as Missy had explained, under that benefit, we're certainly identifying if someone has risk from a safety perspective in staying home independently without having someone available like nursing in the assisted living setting.
Thank you for mentioning that. And there are some questions coming in a little bit. How do I find a Missy in my town? Or we're exploring the avoiding children having to take on these decisions. So one thing I'll mention, I was going to say it at the end, but I think it's relevant right now. At the end of the call, I was going to talk a little bit about how we are going to include, you're going to get a wrap up. Anyone that's on this, we have their email and they're registered for this series. They're going to get an email from us recapping today's session with a link so that, yes, you can watch it again. If you've got family members, we've heard that from a few people saying that, is this going to be recorded? Yes, it will be recorded. But in there, there's going to be a few things in there. We are going to do a personalized Zoom visit. So if you want to sign up to try to figure out how to formulate that plan, what does that look like for your personal situation? Doing it on Zoom with 100 people probably isn't the best time to talk about your specific situation. So we are going to have a link that you can sign up if you want to talk with a team member to find a Missy in your town or to figure out what that plan needs to look like. We're going to offer a Zoom link for that. So I'll mention it again at the end, but just to mention it now, since we're getting a few questions on how do they start this process. I'm going to jump over now. I want to talk a little bit with Brenda because she's turned her camera off, but I'm going to turn it back on for a minute because as we're talking a lot about safety, security, maybe loved ones not seeing our loved ones as often right now because of COVID and trying to protect them because of everything that we're exposed to. How do we make sure that our loved ones in their own homes are safe and secure from scams and fraud? I believe in South Dakota, we just heard about a gentleman who was scammed out of $500,000 in the last week. It's real. Around voting time on election day, there was scams saying don't vote today. It's been moved till tomorrow. So I want to turn it over to Brenda and have her talk a little bit about how we can keep our loved ones safe from scams and fraud in their own homes when, again, we're trying to be distant a little bit to keep them safe, but we still want to keep them safe.
Great. Thank you. Thank you so much. Yeah, I'm sure you're kind of thinking, when I was been listening to the first, set group of panelists are thinking safety, security, really, what does SMP have to do with this? But really a lot because S&P educates Medicare beneficiaries and their family members, which is important, and caregivers about healthcare fraud. And that protects the beneficiaries, but it also helps to preserve the integrity of the Medicare and the Medicaid programs. And that's so important because we want those programs around when our, like the millennials, when they come of age. So we want to make sure that these programs are around for them. With all the social isolation that is going on, it is a huge factor during this pandemic. Families are not being able to socialize and kind of check it. It's kind of a checks and balances with family members. We've got a lot of family members that are on the cusp of, they're still very independent. However, just as for myself, I have an aunt that I moved into the Wellington, and she actually was very independent. She was worked in banking industry for like 40 years and is very independent. However, she's starting to lose a little bit of, of the cognitive aspect. And so she was having me kind of balance out everything for her. And now that I can't sit down with her, she is real nervous about the fact that she's not getting her bills paid, and those kinds of things. And so that hands-on, and caregivers are very much involved with that as well. Not just family members, but the caregivers, the ones that were going into the homes with the home health services to help these people. And so, of course, because all the fraudsters know that this is such a huge factor, they know that we have so many isolated adults out there, elderly people out there, that they are taking advantage of them. And it just makes me so upset that they can't find something better to do with their time than to take advantage of our elderly. So some of the things that are happening in North Dakota, first of all, I want to explain this first thing I'm going to talk about is not a scam. Every couple of years, the CMS does what's called a Medicare Current Beneficiary Survey. It's called MCBS. This is a research project. It is true. It is designed to provide information on healthcare experiences of Medicare eligible persons across America. This is legitimate. Normally what they do is you would get a postcard in the mail saying that you've been chosen, someone will come to your door. But because of the COVID, this isn't happening. And so what they're doing is they are still sending out a postcard, letting them know that the individual will get a call. And you don't have to answer the survey questions, but there is just this is something that is real. It is not a scam. And so we just want to make sure that people actually are aware of that. There is a telephone number that you can actually call to verify that you are part of this study. And again, like I said, this information is really relevant to moving ahead so that they can kind of, improve the Medicare program is basically what they use that information for. Another one that is still huge and is roaming the nation and North Dakota is the new Medicare card. The chip, the plastic card, it's huge, and people continue to fall for it. Another one that has gotten to be really big now is the contact tracing. So during, COVID, we want people to be aware that, you could be getting calls about testing kits, home testing kits, and to be on the lookout for different like charity scams in particular for COVID-related activities. But the contact tracing one is, you're going to get that, and you do get that call. If you test positive, you are going to get that call. However, the real contact tracers are going to be either contracted or from your state health department. They're going to ask you like about your symptoms. If you've been in touch with anybody, they are never, ever, ever going to ask you for your Medicare number or your healthcare provider number. That's the important thing to remember, is that any calls that you get and they are asking for your Medicare number, you know that those are fraud-related calls, and do not give out that information. Along that line too, then what they do is once these fraudsters get that Medicare number, majority of time what they do is they will bill out braces to the person's Medicare number. And that's where we're seeing it then on the Medicare summary notices that the individuals get every quarter. You're going to see some odd billing on there for either some testing that you didn't have done or for some braces that you received. And another one to keep in mind is during Part D enrollment. We are still in that until December 7th. And so a lot of times we're getting, individuals are getting calls that they must enroll in this Part D plan or this Medicare Advantage plan, or they're going to lose their benefits. It's a scare tactic, but people are getting those calls. And the biggest one, I actually had a couple of calls in the last week or so. So just want you to know, Medicare, the Centers for Medicare and Medicaid, Medicare does not do welfare checks on their beneficiaries. So that's a new one in the state, that a couple of people have received calls from Medicare, and they are asking how they're doing. And one of them, the daughter called me and she just said, yeah, she said, Mom was telling me that she got this call from Medicare. It was the nicest person. Just wanted to check to see how she's doing, make sure she's doing okay during this, time of isolation. And she just needs her Medicare number because she has to document that she actually made this call as part of her job. Those are not real calls. Those are absolutely fraud calls. I was on a national conference call yesterday, and there's some emerging scams that we need to be aware of. Again, always make sure that you look at your Medicare summary notices. So some untoward professional people have found that if you add cough to the diagnosis for the COVID visit, it increases the reimbursement. And it also includes the testing reimbursement. So if you add like cough in the doctor's notes, even though you don't have one, it will increase the reimbursement rate. Another one that we are anticipating is going to be huge is with the new COVID vaccine. And it has already started. Beneficiaries are getting calls indicating that due to their medical history, they have been selected as high priority for the vaccine. And a health person will actually come to your home to administer the vaccine. And then the caller asks for the Medicare number so that they can start the paperwork process for that vaccine and that visit. That we are anticipating that that's going to be a big one. And so we want people to realize that no one's going to come to your home and give you that vaccine. No one's going to call you. And if they are asking for your Medicare number, you definitely need to hang up on that. Another one is mask filters. Apparently there's a lot of chatter about replacement filters that people can put into their masks. Again, this is all fraud related. There is, like I said, it's, if you're actually looking at filter replacements, you're probably looking at like the kind that they wear in the hospital. We don't have access to that. So there's not going to be filter replacements. And just, kind of a word of caution. If your Medicare number has been compromised, it's a trend then that you are going to see that Medicare number is going to probably going to see fraud related to again down the road. So especially when it comes to the COVID-19 fraud. So if you have had a compromised Medicare number in the past, please be very cognizant and aware that you need to be watching those Medicare summary notices for any kind of charges that that do not that are not yours. So that's just kind of some of the cusp of what's going on in the state of North Dakota. Again, awareness, family members and caregivers always reminding our senior population that no one's going to call and ask you for your Medicare number. Do not give it out. That's probably the most important information that we can share.
That's a good note to end on, that you should never be giving your Medicare number over the phone, ever. A question that came in, is a chipped Medicare card a scam?
Absolutely. There is no such thing. There is no such thing, nor is there a plastic Medicare card. If you get a call about sending out a new plastic card or a chipped one, those are absolute frauds.
And if somebody has had that happen, or they've sent money, or they've done something, who should they notify? Their state's attorney general's office, or who do they notify?
We work very closely. S&P works very closely with the state attorney general's office. And so if you're not sure, if you call the attorney general's office and they realize that there is healthcare fraud involved, they refer you to us. If you call S&P and I believe that there's been some personal financial data breach, we will refer you to the attorney general's office. So we work very closely. So either one of those is an absolute perfect place to report.
Somebody's asking about, could you put together a session on the fraud that Brenda's mentioned? This is scary. Agree. I think that's something that we should do again, talk just about the scams and fraud. It is, so I don't have a name on who said it, it just says anonymous. So I agree that that's stay tuned because I think that's worth doing. And then as far as a number you can call to stop the scams, Jody, I don't know what state you're in, so I would just recommend calling your attorney general's office, getting them in the loop that it's happening, and they might have some more specific information based on where you live. I think that would be a good spot to start. And is there anything else, Brenda, regarding scams, phone safety, anything else that you want to recommend to, is the no call, is that still a thing where you can sign up for the no call registry?
That is absolutely still. To get your name registered on the do not call list, here's the thing to remember about that. And so, I mean, you can do it for your cell phone, you can do it for your home phone. You should only ever have to do it one time. You should not have to do it again in 5 years. Once you've done it, and it should apply to that telephone number where you call from to put that on the do not call list. However, if you happen to be sitting and watching a TV infomercial or commercial, and there's an 800 number to call to order some supplies or to, looks like an interesting Part D plan. Once you call that number, you have now opened the door for marketing calls. So you want to be very careful when you call like those 800 numbers or any of those numbers for any of those advertisements for braces or any of that, because once you open the door with that, it opens up, it's almost like it voids out that do not call. And so you just have to be very careful about that.
Thank you for going through that. I'm answering some questions here. We're kind of getting close to the end of our time here. Brenda, thank you for all your information that you're giving. How about Missy? Missy, is there any ending last topics that you want to mention that we've kind of breezed through on your part today? Is there anything that you want to end on today for you?
Just get out there and start having that conversation. I mean, that's what's going to open the door, and don't be scared to have it. Everybody's in the same boat, and we're available. I mean, they're going to send you the link. We'll gladly do a Zoom call and kind of walk you through. There's a lot of experience on this panel, so you could use it.
Thank you, Missy. Jackie, any last thoughts from you as we kind of get to wrapping this up?
Mine would be to just, be present and looking at all those things that I had mentioned, check over their medications every once in a while, make sure their houses are free of clutter, or your house if you're watching this as a senior. And if you do feel like they're at that point of needing services, definitely talk with your doctor. They're going to be very knowledgeable about all of that and get you down the correct pathways. As well as, someone like in this panelist community. I mean, there, like Missy said, there is a lot of knowledge here with these people that can get you in the right direction as well.
Thank you, Jackie. Brendan, any last thoughts from you on any of this? And home health, I know we didn't spend as much time on that, but.
The difficult conversation and starting that early and planting seeds, I think is a very difficult thing. I've been through it. I don't know that this is for this conversation today, but the one that we encounter a lot with Caring Edge home health, outpatient, and hospice is the hospice conversation. It's a really difficult conversation to have. And so, reaching out to those experts to help guide through those conversations or have the conversations is the best advice that I could give. Thank
you so much for that. I guess to give a quick recap of upcoming sessions, just so that if you're just joining us on this series, we still have 3 left. The next session is going to be, and they're every 2 weeks, The Zoom link that you clicked on today is going to be the same Zoom link that works for you if you're calling in, if you're on Zoom. It works again. If you're watching on Facebook and you haven't actually registered yet, go to edgewoodhealthcare.com and it's /series 2020, or get in touch with info@edgewoodhealthcare.com. We can get you registered so you get emails and you're signed up for the rest of the session. The next session is session number 4. That's going to be on Wednesday, December 2nd at, again, 12 o'clock Central Time, 11 o'clock Mountain Time. And that topic is going to be caring through the holidays. Everybody knows that the holidays are going to look a lot different this year with COVID for every single one of us. So we're going to talk a little bit about some ideas for if your loved one's at home, if your loved one is living at a senior living facility, kind of how to stay connected. And we're going to talk a little bit next time about mental health, because that's a really key important issue that needs some discussion and some attention, especially knowing that the holiday season can be hard on anyone normally. And then when you add COVID to the mix, it can make it even more difficult. The session after that would be Wednesday, December 16th, and that's going to be My Two Elaines. That session is going to be with Governor Marty Schreiber. And so that one's going to be not as much of a panel presentation, but Marty Schreiber, I've got my book right here, is going to be on sharing his story about his journey with My Two Elaines and his wife Elaine, who is currently living in a memory care in Wisconsin. We also are sending out free copies of this book. If you guys could see my office over here, you'd see the variety of boxes and shipping information or shipping labels I have. So please make sure you sign up for that book. There's no cost to getting this book mailed to you. So again, in the email that you received today, you will receive a link to submit your address. So please make sure you've done that. I've already started mailing them out. I'm going to keep mailing them up until the session. I've got a lot of books here, so don't be afraid to pass that information on. If you're watching and you're like, I want to get my sister a book, pass that information on, that email on, to get her registered, get your family, friends registered if you think it would benefit them. The last session, though, as Brendan was saying, is the 6th session, and that's going to be on hospice and end of life. That one is going to be on December 30th, again, also at noon Central Time, 11 Mountain Time. All of these will be recorded, so if you are unable to, due to the holidays, or maybe you are traveling, or some other commitment, they'll all be recorded. So again, you'll always be getting that link with a recap so you can watch on your own time. So again, if you have not registered, I'd encourage you to do that. That way that email comes to you and you don't miss any of the videos. So thank you so much. I want to thank everybody who joined us today on Zoom, on Facebook Live. And I want to say a huge thank you to all of our panelists for sharing their wealth of knowledge and information today. There's a lot obviously going on, and I know we're just trying to keep all of our loved ones safe, happy, healthy in their homes. So I appreciate each and every one of you going through and sharing your expertise on your area. Please, again, in that recap email, sign up for the individualized Zoom consultation. It'll be a lot more private, where it's not you and a bunch of people. It'll just be you and maybe your family members or whoever you invite on, with somebody from Edgewood to talk a little bit about how to have that conversation and come up with a plan, and maybe services that are available in your area if you think it's time for that. Thanks again for joining us. Have a happy and safe Thanksgiving. Wear your mask, and thank you, everybody.